to the Agent Survival Guide podcast, Friday 5. This is our weekly list of 5 things agents should know about. I'm your host, Sarah Ruppel, and it is Friday, May 31st. June is quite literally around the corner, and for us at Ritter Insurance Marketing, this is when the very early days of prepping for enrollment season begins. One thing that I particularly enjoy about this time frame, there's a familiarity and rhythm of what to expect. After you've been through 2 or 3 enrollment periods, you start to get a feel for when pertinent information is released by CMS, as well as what steps you need to complete and when you need to complete them. Now, for us, it is our job to stay on top of all of these announcements so we can bring them to you as soon as possible so you can get the dates in your calendars and stay on top of everything that needs to be completed prior to AEP for those of you selling Medicare and the OEP for those of you in the under 65 market. If you're selling both, well, there's double the amount of info to keep track of. And that is on top of all of the other stuff that you've got planned with family and friends right now. It is a busy time. So coming in at number 5 this week, just in case you missed it the first time around, we have 2 resources that can really help during this busy time frame. A sales planner for agents selling Medicare and a calendar for ACA agents. Both include important dates, reminders, goals, and action items broken out by the month in which they should be completed. And bonus, because they come in PDF form, you can download them to your devices and mark them up to your heart's content. I would suggest adding in renewal dates for your insurance license, as well as keeping track of continuing education credits. We will have the link to those PDFs in our episode notes if you're ready to download them now. And if you would like more information, we have episodes all about the calendars. Those will be linked in the notes as well. Number 4. Ruppel recommends. This week, Fitbit announced a new tracker for kids that I could see a lot of parents adopting as a stepping stone before a smartphone, myself included. It is called the Fitbit Ace LTE, and it combines movement tracking with gaming, as well as GPS tracking, calling, and messaging with a subscription to the Ace Pass data plan. Now, the cool thing about the Fitbit Ace LTE, it doesn't require purchase through a cell phone carrier for the device to work. Your kid also does not need to have their own phone. There is an app that comes with the Act LTE, and that is how everything is controlled. Parents can manage contacts, send and receive voice and text messages, view real-time location, and in a few months, Fitbit owner Google plans to add tap to pay, allowing kids to access money without having to carry cash and risk losing it. As far as the fitness tracker goes, the Fitbit Ace takes gamification to a whole new level. It encourages movement through playing games, and the more your kid moves while playing those games, the more game time they unlock. The Fitbit Arcade updates regularly to introduce fresh content, so hopefully your kid will not get bored with what's available. Each Ace LTE comes with something called an EG. That is a customizable creature that thrives when your kid completes their movement goals and daily activities. They earn arcade tickets, which can be spent to either customize their EG or its home. Fitbit could have stopped there with the EG, and the Ace LTE would still have been pretty cool. But the features don't stop there. They also added collectible watch bands that unlock features, sort of like how Apple Watch bands unlock themed faces and wallpapers, but with more in common to Nintendo Amiibos, the cards and figurines that not only unlock additional content, but they're collectible and tradable. There is a bit of a buy-in fee here. The device is $230. The collectible bands are $35 each. And the ACE Pass data plan is either $120 annually or $10 a month. So either way you choose to go with the data plan, you'll be all in at just under $400. But if you've got a kid that's not quite ready for the responsibility of a smartphone, this might be a good next step that offers a lot of fun and customization options. And if I'm being honest, I kind of want a similar version of this for adults. You can pre-order a Fitbit Ace LTE for your child or wait until June 5th when it hits the Google Store and Amazon. It looks like there is currently a deal on the subscription cost between now and August 31st. So we'll be linking to the official post in our notes, as well as the Verge's notes on the announcement if you're looking for more information and to see what the Fitbit Ace LTE is all about. Number 3, on Wednesday this week, a new report came out about artificial intelligence, which, let's be honest, there have been a lot of those lately. And no, we are not going to talk about how a certain AI search told people to put glue on their pizza or to eat rocks. Do not do those things. The report comes from research carried out by Reuters and the University of Oxford. They asked respondents from 6 countries, Argentina, Denmark, France, Japan, the UK, and the US, a series of questions focusing on awareness and usage as well as expectations for generative AI. Here are some highlights from that study. ChatGPT was found to be the AI tool most respondents used, and by quite a margin. ChatGPT was used 2 and 3 times more than Google Gemini and Microsoft Copilot, which were the second and third most used options. That being said, though, around half of respondents said that they had heard of ChatGPT. 20 to 30% of those surveyed had not heard of ChatGPT, Google Gemini, Microsoft Copilot, or other, quote, popular AI tools, unquote. AI adoption was more common in younger demographics. 56% of those age 18 to 24 said they used ChatGPT at least once, while 16% of respondents ages 55 and over had the same reply. When looking at ChatGPT use specifically, the study found that frequent use was rare. In fact, as far as U.S. respondents reported, only 7% said they frequently use the AI tool. The main takeaway from this new study is that while there is certainly a lot of hype around AI, there's not a lot of people that are actually using it on a regular basis. And that could be for a variety of reasons. One of which that I would suggest is that we are still in the very early stages of AI development. Still, it's a fascinating study, and it tied in so well with our last question of the week. 2 weeks ago, prior to Camp Ritter, we asked, how comfortable are you with using artificial intelligence? We gave a range of potential answers, and we did end up with another tie here. But your responses echoed what the researchers at Reuters and Oxford University found. In absolute last place with no votes, I use it almost daily. Second to last, the I've dabbled answer. In second place, it's useful for certain tasks. And then tied in first place, I haven't tried it and not interested. So I think that says a lot about the state of AI right now. Personally, I think it's probably smart to be cautiously optimistic at this moment when we are, again, in the very early stages of AI development. Now, will it stop advancements in this area? Probably not. But if people aren't buying in, it'll be interesting to see where we go next. Personally, I am rooting for wearables in the form of smart glasses as the next big thing. As long as they look like regular glasses and come in prescription strength, then add in some speakers to do away with the need for headphones, include some overlays with info on museum exhibits, national parks, historic landmarks. I could get into that, but let's keep moving through our list with a very cool find at number 2. On Wednesday this week, KFF published one of the most comprehensive resources on healthcare policy that I have come across, all housed in one place. Dr. Drew Altman and his team aptly named their resource KFF's Health Policy 101. In the 101, they've broken down the variety of topics KFF typically reports on into chapters. Each chapter covers one topic, and if you're familiar with their website menu, you'll notice a lot of congruence between the two. Chapters are further broken down into subtopics, sometimes phrased as questions, and are written in a format that's easy to understand, often containing helpful visuals with up-to-date stats, which we love. The KFF Healthcare Policy 101 provides policy info on insurance, from government programs like Medicare and the ACA to employer-sponsored coverage and private health insurance regulation. They look at how the different options are financed, what is covered, and then how all of those aspects relate to people, from the people who are covered by healthcare insurance to the different branches of government and their roles in creating policy. Each chapter can be accessed online or downloaded as a PDF. There is a ton of information covered, and I think it is an incredibly useful resource. Now, it was created with faculty and students studying healthcare policy in mind, but there's definitely a lot of crossover for agents and other industry professionals here. If you're brand new to the industry, maybe you have downline agents who are brand new to our industry, I would suggest this resource in addition to your current onboarding and training materials. I think there's a lot of value in being presented with the same material in different formats. I think there's also value to those who are a little more seasoned. If you're branching out into a new area of sales, maybe you're adding Medicare products to your portfolio for the first time, or you've decided to expand into under 65 sales. Maybe with all the recent compliance changes, you just want a better understanding of how healthcare policy works, to understand how and why rules and regulations are constantly shifting. I am a very curious person by nature. I like to know the why behind what's going on. So keeping up with policy changes helps to scratch that itch a little bit. And I'm honestly pretty excited to dive into this resource. We'll be linking to the full KFF Healthcare Policy 101 resource in our episode notes. There are 14 chapters, including the introduction, and I encourage you to bookmark each chapter or download the PDFs, whichever resonates more with your learning style. And speaking of learning, shameless plug here, if video is more your style, definitely check out our online video training library, Night School. We take viewers through the agent journey, starting out with getting your license all the way through growing and expanding your business. That link will be in the notes as well. And again, to get to those, just click on the title of this episode and you should see the list of what we covered in today's episode, along with all the links we mentioned here today. Moving on to our top story this week. Coming in at number 1, the event that, for me at least, kicks off the AEP prep season, the official announcement from AHIP on when the current plan year certification closes and when the new plan year certification goes live. Typically, there's a window of time where the site will be down, usually 2 or 3 days that fall over the course of the weekend. And then when the site comes back online after being down, the new version of the test is available and ready for taking. This week, we got the official word that the 2024 version of AHIP's Medicare and Fraud, Waste, and Abuse training will no longer be available as of Thursday, June 20th at 11:59 p.m. AHIP training will be unavailable from Friday, June 21st through Sunday, June 23rd. The new 2025 Plan Year certification goes live on Monday, June 24th. So far, there's not an exact time listed for when the 2025 Plan Year training will become available, but if that changes, we will keep you updated between now and then. Another change coming to AHIP certification, and this change goes into effect on June 1st, 2024. So yes, tomorrow. Some states have recently passed a law subjecting digital and online courses to taxation. If the tax laws are applicable in your state, those sales taxes will be added to your purchase, beginning again tomorrow, June 1st, 2024. Because the sales tax is mandated at the state level, I would suggest visiting your state's Department of Revenue for guidance on the definition of digital goods and services to see whether or not the definition applies in your state. If it does, you should also be able to find information on the amount of the tax. Now, over the course of the next 3 weeks, we will be counting down to the release of the new 2025 Plan Year certification from AHIP. So make sure you're following along with us for those updates in future Friday 5 episodes. That brings us to our question of the week. And we want to know a little bit more about your learning style. There are a lot of different ways to study and absorb information. So we want to know what works best for you. What type of study method do you turn to for important information? Like when you're completing certifications or learning about a new product. Head over to bit.ly/ASG question and let us know. That's bit.ly/ASG question, or simply use the link in our episode notes. We look forward to hearing from you. Thanks so much for doing that and for taking the time to listen today. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel, script editing and fact check by Tina Lamoureux, podcast design by Urban Rivera, artwork by Vivian Zhao. Follow along with us wherever you like to listen.